Zambia has begun administering oral cholera vaccines to people in the worst affected areas of Lusaka as the capital battles an outbreak of the waterborne disease. More than 370 cholera-related deaths and nearly 10,000 infections have been recorded across the Southern African nation since October. CGTN's Foray Makutuya has more.
Hundreds of cholera patients are being treated at Lusaka's Heroes National Stadium, the makeshift facility set up to handle the huge number of those seeking medical assistance. Cholera has spread to 45 districts, but the capital has been hit the hardest by the outbreak, especially in its overcrowded informal settlements where sanitation remains poor.
I would suggest that they come and unblock the drainages. We have got a shortage of water. We've got a lot of pit trains in the compound, which is not good.
The Zambian government's response, which has been focused on case management and prevention through promoting the use of clean water and hand washing, is being expanded to include vaccinations. On Monday, the Health Ministry received 1.4 million doses of oral cholera vaccines from UNICEF.
The vaccines we've received are not adequate for a countrywide non-selective response. Therefore, they will be deployed in a phased manner in targeted high-risk areas for us to achieve impact in controlling transmission, illness, and death.
Ordinarily, 2 or 3 doses would be administered on one person, but because of the huge and widespread increase in infections, only 1 dose will be given so that more people can be vaccinated and protected from getting the disease.
So this is a short-term measure. It's not a magic single bullet, and I really just wanted to reinforce that. So all of the other measures that the Minister outlined, all of the other high-impact prevention and control measures must be adopted along with the vaccination efforts.
The permanent interventions include fixing water and sanitation systems, improving waste management, and clamping down on unplanned settlements.
Government, we have responsibility to make sure that certain fundamentals are in place. And this is not fun to say, but unfortunately, that aspect has been neglected for a very long time for our history as an independent country. So the structural things which should have been in place with respect to cholera, especially in our peri-urban slums, are not in place. It is a huge, huge problem.
Unless they are urgently addressed, public health experts warn deadly outbreaks could recur in the future. Foray Makutuya, CGTN.